Welcome to the Mano podcast. I'm George Laws Garcia, Executive Director of the Puerto Rico Statehood Council. On today's podcast, we will be featuring Luis Luigi Pizarro Otero. He is the immediate past president of the Puerto Rico Chamber of Commerce, where he championed initiatives to strengthen Puerto Rico's business climate and competitiveness and focused on Puerto Rico healthcare federal policy. He serves on the board of Discover Puerto Rico, the destination marketing organization promoting the island worldwide. With more than 16 years experience in Medicaid, Medicare, and private health insurance sectors, Luis has played a key role in advancing healthcare reforms and promoting equity for Puerto Rico within federal healthcare programs. A licensed attorney in Puerto Rico and the Federal District Court, he holds an LLM in health law from Loyola University Chicago, a JD from the Inter-American University of Puerto Rico, and a BA in International Affairs from the George Washington University with postgraduate studies from Harvard Business School. Luis lives in San Juan with his wife and 2 children. Welcome to the show. Welcome to the Mano a Mano podcast, Luis.
Hey, hi, George. Thank you for having me.
Excellent. Well, Luis, we're really excited to have you because as someone who's been involved in Puerto Rico's private sector extensively, but also had a huge amount of focus in your efforts here on DC regarding federal policy, I really want to, first of all, let our audience know a little bit about how I've gotten to know you. I believe it was somewhere around, 15 years ago or so, you began coming to Washington, D.C. to do advocacy work around Puerto Rico healthcare issues and the Medicaid cliff and the Affordable Care Act. So you've been coming to Washington, D.C. in a few different capacities. Sometimes as part of the MAPA, the Medicare and Medicaid
Product.
Association.
Yep.
Products Association. And then sometimes more recently in your immediate past role as president of the Puerto Rico Chamber of Commerce. The first thing that I'd like to ask you is, how have you seen the attitudes in Washington towards Puerto Rico shift since you've been coming here?
Oh my God, I think it has been a big change throughout the years, as you mentioned, since pretty much when I started working in detail in the healthcare with the healthcare system and the healthcare environment. I in 2009, and the discussion of the Affordable Care Act under the first term of President Obama, we started having, conversations as a healthcare community in Puerto Rico of the impact of the law and any unintended or intended consequences to the island. So as soon as we started seeing some of those unintended consequences on the market and the system as a whole, we started shifting from the implementing the law to see how we can start doing some advocacy to avoid further implications to the system. So, throughout the years, I started building, working with other trade associations like the Hospital Association, the Physician Guild, the community pharmacies, and we started delivering messages in Congress about the consequences of the law in Puerto Rico in terms of the impact and the funding, particularly the Medicare funding for the island, because the law, what it did was like a bit of a fund shifting from Medicare to Medicaid. But the catch for Puerto Rico is that the Medicaid fund that we got was just like a block grant from 2009 to 2019, which ended up running out on 2017. But to your question, particularly those years, if we were to say the IQ level of congressional offices, staff and members was extremely low about Puerto Rico's ABC of the Medicaid and the Medicare program. And to what it is today, it has been an incredible increase in terms of the IQ level, even though there's a big turnaround of members of Congress and staffers. We've been able to like set a new standard or a new baseline with each office, because we're continuously been coming to Washington since 2009 to continue these conversations.
So I think for the benefit of the listener audience, it may be helpful to just explain a little bit about why the efforts for advancing Puerto Rico's health equity under the Affordable Care Act were so important. And I think we have to begin with explaining a little bit about where Puerto Rico's health federal funding was before that. Obviously, our audience is well aware that as a U.S. territory, Puerto Rico gets treated unequally for a number of different federal laws and policies. And one of the most significant ones is specifically related to Medicaid, which is the federal program that provides funding for medical services for people of lower income, and Medicare, which provides support for elderly people that are retired to receive the federal funding that they need to have their medical needs met. Can you tell us a little bit about kind of where Puerto Rico's funding gap was before the Affordable Care Act, and then how the Affordable Care Act reduced that funding gap, but still kind of left us in a vulnerable place over the long term?
Puerto Rico uh, was included in 1965 under the Social Security Act to get Medicaid and Medicare funding. The difference was that in the case of Medicaid, as you mentioned, Medicaid is a program, a federal program for the indigent population, and it works with local, state and federal funds. But Puerto Rico being a territory, we were not included in the formula that provides a funding similar to the NAP to SNAP policy issue about food security for Puerto Rico. That operates under a formula of accounting for the people that are under the federal poverty level, and it's called the FMAP, is a federal matching assistance percentage.
So just to get that clear, so for all states, all of them get a certain match that the federal government gives them, and that match is dependent. Yeah,
Based on the federal poverty level that state has.
exactly. So based
So
on the population and the number of people that fall within the federal policy level. But for Puerto Rico, how does that work?
Puerto Rico, we're not in that formula. We receive like a block grant. So we do have an eligibility threshold and a matching, which is 55% federal funds, 45% local funds that the state funds that Puerto Rico has to chip in. But it's not like based on the formula ongoing. It's that rationale of 55-45 with a cap. And that cap, if we use all those funds, then we have to add above and beyond that 55-45. That's how Puerto Rico was operating from 65 all the way to 2009, when the ACA, the Affordable Care Act, the Patient Protection and Affordable Care Act, was approved in two packages in May 23rd, 2010, and March 23rd, 2010, and March 30th, 2010. And if, for example, if Puerto Rico were not under that cap, that block grant, Puerto Rico would have, based on our federal poverty level, we would be under the same threshold as a state like Mississippi, which is the poorest state. So we would have a matching of 83% federal funds, 17% local funds.
So that means that because Puerto Rico is a territory and isn't being treated like a state, instead of getting a federal matching up to that 85%, you know, our regular standard matching rate pre ACA was 55%, which means that 45% of the money to, you know, meet this need that is equal to the needs of any other state has to come from the state funds, right? The territories funds.
That is correct.
So Luigi, basically, what I'm hearing you say is that before the ACA, Puerto Rico was basically fighting for just having a more equal level of participation in the Medicaid program, and that then, you know, after the ACA, that percentage went up. How much did it go up, and then how much of the gap between where Puerto Rico ended up and where states are is still left to go?
Well, Puerto Rico, with the Affordable Care Act, and we were just talking about Medicaid. I
Yep,
didn't mention anything on the Medicare side. There are still
there's gaps
other,
there as well.
but we'll get into that. In the case of Medicaid, before the ACA, as you mentioned, you know, we were trying to raise that the level of funding, as well as the cap and the matching. With the Affordable Care Act, Puerto Rico was able to get, the territories got $6.3 billion. So it was just an increase of the block grant. Of those 6.3 for the territories to be distributed in proportion to their population, Puerto Rico accounts for 90% of the population of the territories. So Puerto Rico got $5.8 billion for its
Over what
Medicaid program to
what
be
period?
spent from 2011 to 2019. Not, you know, there wasn't any restrictions per year. That was just
Hmm.
the intended distribution.
Yeah.
But Puerto Rico, you know, unfortunately had some local model changes, and it went from 100% managed care model. It stayed as a managed care model, but it had, instead of having MCOs insure 100% of the risk, the government in I think it was under the Alejandro Garcia Padilla years, they changed with one of the MCOs. Not, you know, the government would assume the risk, so the MCO was only, the managed care organization was only providing third party provider services, TPA services. Government, you tell me who to pay, I pay. So they were just administering. So the government was a full risk, and there wasn't good management,
Mm.
unfortunately. So the money ran out by 2017.
And this
Uh,
is when the famous Medicaid cliff basically first began to show itself. Can you tell us exactly what is the Medicaid cliff and why, unfortunately, that continues to be an issue that persists for Puerto Rico to this day?
Sure. The Medicaid cliff is just literally, it's a fiscal cliff in which Puerto Rico's that block grant would just run out of funds. And if we run out of funds, then we would revert back, because it was not only the total amount of funds, but also the rationale of the matching federal to local funds. And in that regard, Puerto Rico, as you mentioned, you know, 2017 was their first cliff. So, in a weird way, and this may sound inappropriate, but it is the truth. I guess, from every disaster, something good comes out, and please don't, get me out of context. But one of the best things that may have come out of the disaster of Hurricane Maria was that Puerto Rico got additional federal funds before the 2019 threshold, and got under the first term of the President Trump administration, got 100% of federal funds matching to the Medicaid program. So no local contribution for 2 years, from 2017 to 2019, was enacted into law to provide as part of the disaster relief package for Puerto Rico.
Yeah, and I remember this period of time intimately. I worked in the Washington D.C. office of the governor at the time, Ricardo Rosselló, and I remember working with you and with other colleagues in the private sector across party lines, meaning that all the different political parties in Puerto Rico aligned on this because of the incredible need to make sure that, especially in the immediate aftermath of Hurricane Maria, we didn't also have the crisis of having our healthcare system basically collapse, which is what would have happened if, on top of dealing with all the disaster response and the emergency response, if suddenly there was an immediate cutoff and decline in the amount of federal support for meeting the healthcare needs of the most vulnerable population on the island. So, since Congress had put so much attention on Puerto Rico, the response to the hurricane actually became an opportunity to address this issue. There was an issue that was beyond just its relationship to the disaster, because it's an issue that was there before the natural disaster happened, and unfortunately is actually still there to this day.
Correct, correct. It is, and it was very important because that sort of set the tone for from years to come. Uh, Puerto Rico since then has we had in the period from 2019 till today, we've had like temporary packages in which we've been able to negotiate and increase the cap, the total amount of the block grant, and increase the federal matching, the rationale of the federal to local to state funds ever since. And obviously, we had 100% matching and enough funds to carry over to run the program from 2017 to 2019. Then in 2019, we have another temporary relief. I don't remember the exact details, but we have been able to sustain a federal matching of either 83 to 76 federal to local funds in the different budget approvals by Congress,
The
the
different
different
appropriation bills, yeah.
the different appropriations bills, the omnibus, the minibus, all
Hmm.
those throughout the years. In fact, during COVID, we had the 83 plus 6.2 that was enacted into law for any state and territory. So we were able to with the 76, we had like 83% for, or 82 point something,
And
for
that's
a long period of
and
time.
that's the FMAP. That's the matching percentage. But one question that I have for you is, even with all of these short-term extensions of funding and of the higher matching level, has Puerto Rico at any point been able to reach a level of funding for Medicaid that is actually equal to the amount of funding that Puerto Rico would receive if it were a state?
No, we have not. We've been able to consistently increase the base of the base payment of that block grant. The biggest, largest achievement was in 2022, the last
Yeah.
package that we're currently on. It was a historic collective achievement between the government, Governor Pedro Pierluisi, resident commissioner at the
Jennifer
time,
Gonzalez at that
Jennifer
time, yeah.
Gonzalez Colon, and the private sector, where we were able to secure $19.4 billion for Puerto Rico over a 5 year period. So Puerto Rico currently is, from 2022 to 2027. Each year, it does have a chart. I think it's about $4.3 billion
Yep.
this year that Puerto Rico's getting, and that is a significant increase to where we were. And the way we achieve that is it's not, we're asking funds for just because we want to be like any other state. What we did, the strategy was for us to itemize the different essential mandatory federal benefits that Puerto Rico has been unable to include,
Yep.
because each state, the way Medicaid works is each state has their own plan that
Yep.
they submit to the federal government, and they call the SPA, the State's Plan Amendments to the Medicaid program. The federal government approves. So there are some mandatory essential federal benefits that Puerto Rico needs to ask permission not to include just because we don't have
We
enough
don't have the
funds.
funding level. Exactly. Yep.
The pink elephant in the room for that is long-term care
Yeah.
services and support, LTSS, long-term care services and support. Long-term care is, it's 30% of any Medicaid program in a state. The average cost of long-term care of that benefit is 30% of any Medicaid program in the nation. So that's a huge benefit that provides services for poor population to have institutional care at a hospital,
Yep.
for homeless people that don't have a roof where to live or where to receive services. It's one of the most basic benefit, but unfortunately, the cost trend of long-term care has been increasing in the nation. So there's a need nationwide for a long-term care reform. So
Yeah.
for Puerto Rico to ask for long-term care, it has been a big challenge, because Congress says, well, listen, we need a congressional reform, a national reform on it, but we have an opportunity because we're doing like a study. We
Hmm.
did get a grant from CMS to do a study of how long-term care would be if Puerto Rico would implement that benefit. But it would not be like the typical institutional long-term care that people receive care in the hospital. It would be more a long-term care in a home-based setting, with human infrastructure, nurses, social workers, and physicians going to people's home, which in theory should be more
Cost effective.
cost effective. So
Yeah.
that would be the number one. But the way so we excluded that one, but we were able to itemize and show the cost of what we would need to include non-emergency medical transportation, diabetic DME, durable medical equipment, lancets, or strips for people
Hmm.
with diabetes, um, eh, prenatal care at the time for immigrant population, or some other benefits. I don't remember all of them off the top of my head, but because we earmarked those additional funds we were requesting for that, that's how we were able to actuarially justify the incremental amount, and that's how we were able to secure those $19.4 billion. We
And
still are far, and we right now we have a strategy of a benefit. It's called the Medicare Savings Program,
mhm.
which is the one that we is even maintaining excluded the long-term care, the one that we are currently showcasing or educating members of Congress on is the MSP, the Medicare Savings Program. Now, if you ask me, Luigi, what is the Medicare Savings Program? The Medicare Savings Program, as you all know, Medicare has Part A and Part B. Part A is hospital costs, and Part B is a physician ancillary services. The way the Medicare program works as a public health insurance program, even though you contribute throughout your professional career, the Medicare payroll tax from your check,
And
even
just to be clear, even though in Puerto Rico, people residing on the island don't pay federal income taxes on their income derived in Puerto Rico, everyone who earns an income in Puerto Rico pays federal payroll taxes, including those payroll taxes that go directly to Medicare.
Yeah, FICA, the federal insurance. So indeed, yeah, we do pay our Medicare payroll tax in the same terms and conditions as any other U.S. citizen in the nation. So even though we contribute to that program in equal conditions, we don't get the MSP. And what
Wow.
is the MSP? The MSP is a program, the Part B of Medicare. Even though you contribute with your payroll, when you get to the enroll into the Social Security to the Medicare program when you're 65 or have a chronic condition, you do have to pay a premium for Part B. That premium is set by the federal government from a year to year basis.
Of course.
I think this year it's somewhere between 179 and 185. That's where it typically has been. So it means that from your Social Security check,
You get a deduction.
you get a deduction to chip in to that Part B premium that you pay to the program to help subsidize your Medicare insurance program.
Sure.
However, if you are a Medicare and Medicaid patient, it's called a dual eligible. You're
Yep.
eligible to both Medicare and Medicaid. So
Because
it
you've
means
reached the age to be eligible for Medicare, but you also have the poverty level to be eligible for Medicaid.
exactly that's the most needy population because you're,
Yep.
in
Older and
in layman's terms, you're old and poor.
yeah.
So the most needy population, the oldest and poorest population of any state. If you're dual, that's what that means
Mhm.
you're dual. In Puerto Rico, it's called a platino. If you're a dual or a platino, in any part of the nation, including all the other territories except for the territory of Puerto Rico, the state with Medicaid funds says, George, you don't need to, the Social Security doesn't need to deduct the 180, $185 per month because we, the state, with the Medicaid funds, we're going to contribute those $185 because you're poor and old. So you need that money for your social determinants of health,
Yep.
for your cost of living. So we with Medicaid funds, we're gonna contribute that.
And that makes perfect sense because part of what that does is it offsets this cost for this elderly population and it gives them a little bit more access to their Social Security, which, in the case of many of these individuals, is their primary source of income at this elderly age. So you really want to preserve that stream of income as much as possible so that they can meet their own needs based on the Social Security and not depend on other government services and programs as much.
I'm doing a simple math, 185 times 12, it's $2,220. So we're talking about real dollars. Imagine that the 300,000 duals of Puerto Rico, the most needy population, would be able to save in their pockets $2,220 each year. That's $2,220 more for food, to spend in the community pharmacy for their medication, for transportation to their in gas for their health
Yeah, for their
appointments.
home repairs, all the basic needs that people need to live. And in Puerto
So
Rico,
that one is the one benefit that, as we approach the 2027 Medicaid cliff, all 2026, we are going to be continue reaching out to both Republican and Democratic offices saying, listen, we not only we want to maintain our current funding structure, but we need to increase our Medicaid funds to be able to cover for the MSP, because much more than being a healthcare policy measure, this is also an economic development measure, because this is funds that people are going to spend in the local economy. So it's going to help out. and it's not some goody benefit that we're asking.
Yeah,
We're,
this is
we're
money that people have already paid into it with their work over the course of their lifetime.
correct, and it's we just want to be in equal terms with any other U.S. citizen from any other territory and state.
So Luigi, I think that one thing that I would like to shift the conversation into. So we've talked about how the legislative progress happened, right? The Affordable Care Act, how that increased the FMAP, and it also increased the cap. The cliffs that have come up each time that that funding stream that is appropriated by Congress kind of runs out, and the fact that we're about to hit another one in 2027. So legislatively, now in 2026, we're going to need to go into another effort to pass legislation to make sure that we're not negatively impacted by that in 2027. But I also want to take a couple of different angles on how this issue has a broader impact on Puerto Rico. One angle, which I think you began touching on, is the human angle. This is an issue that is impacting the health, the well being, and the finances of the most vulnerable Americans in Puerto Rico, right? And it is my personal belief that an elderly person in Jayuya, Utuado, or Ponce, their life is of equal value to the life of an elderly person in Texas, in Florida, Pennsylvania, Alaska, or any other state. And really, when we look at the circumstance that a lot of the elderly people in Puerto Rico, which is growing population, have, this funding is absolutely essential to their well-being. And with this funding being lower, the net the net impact is a lot of people honestly don't get as much care as they need from the healthcare system. They have harder time accessing the doctors and the medicines that they need for their well-being, and their overall quality of life in these elderly years is reduced. So that's a little bit about the human element of it. The other piece, which we touched on briefly, but I would like to get your perspective a little bit more on, is the impact that this funding inequality has on Puerto Rico's fiscal and economic situation. Because if Puerto Rico is not receiving the same level of funding support from the federal government, and more outlays are having to happen from the territory budget, if we don't get a kind of longer term fix to this issue of territorial inequality in healthcare, you know, is that something that is really impeding Puerto Rico from being able to stabilize its long term finances as it attempts to exit the process of the Fiscal Oversight Board under PROMESA? You know, to reduce that a little bit more, how does the federal funding inequality in healthcare and these persistent, Medicaid funding cliffs and inequalities under Medicare negatively impact the capacity of Puerto Rico's government to, budget properly and know what it is that they're going to be liable for versus how much the federal government's going to be able to contribute?
Well, to answer that question, I need we need to spend like 2 minutes talking a little bit about Medicare,
Sure.
because we've talked about mostly about Medicaid, and Medicaid, that it's a federal and local funding. So maybe to briefly address that answer, we need funding stability throughout the years, long-term funding stability, because uh, otherwise, how can we budget
Exactly.
our government finances on a year-to-year basis, long term, if we don't know short term if we're going to have that fund, if we're going to keep that funding stream. So
And if every
every
couple of years we have to go back to fight for just continuing what we have, and we don't know what's going to come out of that, legislative action by Congress.
Correct, correct. And let's say those $4.3 billion that account for the Medicaid budget of Puerto Rico, federal and local, that accounts for about like 27-30% of Puerto Rico's healthcare budget.
Wow.
But if we account for, if we give a full spectrum of that, of the $15.5 billion that account for Puerto Rico's budget, the important one for the healthcare economy of Puerto Rico is the Medicare Advantage funds, because those account for roughly 55% of the healthcare funding for the island. So more than half
Wow.
of Puerto Rico's healthcare funding runs through the Medicare Advantage program, which is a solely a federal program. It's the same program in the 52 jurisdictions that where it exists. The 50 states, Puerto Rico, and the USVI. The other territories
The
don't
other
have
territories.
Medicare Advantage program, but it's the same program.
Mm-hmm.
And under that program, it's based on the cost of traditional Medicare, that throughout the years the federal government used to have like a fee for service chart, say I'm going to pay this amount per fee. And throughout 80s, the managed care model started evolving more with a budget wise. And then under the President Clinton administration, the Medicare Plus Choice program was enacted. That was the first Medicare Advantage program under President Clinton. And then the program, which what was it? Well, it was, the federal government would say, "Listen, I have this fee for service charts of what A and B cost. I'm no longer going to keep this fee for service because it's the healthcare cost continues to increase. More fee for service, doctors more billing, hospitals more billing. The Medicare Trust Fund is going to go bankrupt. So we need to do something. So let's do a budget." And let's say, "Oh, you X company, managed care company, if I give you this Medicare, traditional Medicare cost to you as a budget, can you uh, do cover hospital and physician fees, and in addition provide preventive services to the population?" "Yes, I'll do it." And then, so that's how the program started. Then in 2003, under Bush administration, there was a big milestone because they passed the Medicare Modernization Act, which included Part D, which
Yeah, the
is
prescription
medication,
drug program. Yeah.
prescription drug program. So then it was like it rounded out the program where you have MAPD, Medicare Advantage Prescription Drug Program, where you have A, hospital fees, B, physician and ancillary services, lab, x-ray, blah, blah, blah. C, which is the Advantage part, the preventive services,
Yep.
vision, dental, preventive test. And then D, which is the
Prescription
prescription
drug
drug.
and medication. Yep.
So in Puerto Rico, in 2000, the Medicare Advantage program started, and it evolved in 2006 when they were implementing the 2003 prescription drug. That's when the Platino program was enacted. It integrated both the Medicaid and the Medicare for the dual population under one card, a Medicare Advantage. So for the first time, our elder population did not have to go to pharmacies to ask for a FIAO, to ask for IOU a list, because they finally had funds to cover for their medication. So there is whoever owns a community pharmacy in Puerto Rico, or whoever knows the basics of our healthcare system, knows that there was a before and after 2006,
Yep.
when our elder population finally had funds,
Prescription
and they
benefits.
didn't.
Yep.
Yeah, for that. It was like in 93 with the health reform, the privatization of the health system. For the elder, the poor population did not have to go anymore to the mayor's office to ask them to approve a medication because it was a money compensation. So for the poor population, there was a big milestone in 93 with the local health reform, when the system was privatized and it operated on the managed care budget. And then in 2006, with this Medicare Advantage fusion with the Medicaid for the dual, But unfortunately, that was a big milestone. But unfortunately, when you compare the formula of reimbursement based on the cost of fee for service in Medicare between Puerto Rico and the rest of the nation, we were the outlier at the bottom by far. Like we
Mm.
were, you remember
So
that
what's the gap then between what states receive for the Medicare program and what Puerto Rico's receiving?
uh pretty much, and I have the chart right here. I don't know if you can see it here.
We can't, but what we can do is you can actually send that to us. We'll
Okay,
we'll, we'll add it onto the production so that people can see it on their screen. But if you could just verbally describe it to us, that would be
sure.
incredibly helpful.
Puerto Rico right now is about 32. Mainland rates are 68% higher than Puerto Rico in Medicare
Wow.
Advantage. In 2011, we were 30, the US was 32% higher than
So the
Puerto
gap
Rico.
has basically continued increasing between the amount of funding that people
And,
receive in Puerto Rico for their Medicare Advantage versus in the States.
and that's one of the unintended consequences that I was referencing, because with the fund shifting from Medicare to Medicaid, we were dressing one saint but undressing the other,
Yeah,
because there was a fund shifting. Obviously, the ACA had a very logical reasoning behind it, which was to increase the amount of people in the nation to have access to insurance.
of
So,
course.
so that's why
So you
it
increase
increased.
access, but then you reduce the quality of the access for the elderly in Puerto Rico. And
Correct.
if I can just kind of go back to this issue of the impact on Puerto Rico's fiscal situation, and bring that back up. I think one of the things that people really don't think about too often is that this money that goes into Medicaid and Medicare is not money that just meets these economic needs for healthcare for these vulnerable populations, the lower income individuals and the elderly. It's also money that actually circulates in Puerto Rico's economy, right? Because the doctors and the hospitals and the service providers, all of them receive this money. They then spend it within the economy, buying equipment, employing people, buying different services for their facilities or their offices. They also buy homes. They pay salaries, they pay local taxes. So the fact that this money isn't coming into Puerto Rico's economy is not only having the negative impact on the healthcare and the health outcomes of the individuals in the economy, but it's also depriving Puerto Rico's economy from an amount of demand that would also help to spur more economic activity and more economic growth. Is that your understanding of it?
Indeed, 100%. If we were to simplify, what you just said, Medicaid funds, see at it as if it's humanitarian justice. It's access for the poor to healthcare services. But the Medicare Advantage funds is more about strengthening the healthcare infrastructure of Puerto Rico, the compensation to providers. Why? Because, as I said, it accounts for more than half of the healthcare funding of the island. So Medicare Advantage, in a way, pays the bills in Puerto Rico for the system. So that's why I wanted to give that context about
Yeah.
Medicare, because we about Medicare, because we spoke a little bit about Medicaid, but it's important for our audience to understand that yes, we need to continue to include those social justice
Safety
benefits in
nets. Yep.
Medicaid for our poor population, but we also need to increase the Medicare Advantage funds. We don't need to be, if you account it in absolute numbers, PMPM, Puerto Rico is about 730, 730. dollars per member per month, the Medicare Advantage rate.
How much
The
is it in the
average,
States? Yeah.
the average in the nation, I have it here, is 1,228.
Wow. That's a big
So
gap.
and so our ask, we don't want to, we don't need to be at the 1,228. We want to be, our proposal is to be on the 939, which is what the USVI gets. So it's about $200 more PMPM, which, as you know, USVI on a good day, you can see part of a tip of St. Thomas from Fajardo, Puerto Rico.
Yep.
So we're not saying, we just want to have be in the same terms and not be at the outlier at the bottom. Why? Because to your question about the impact on the economy, this what we're talking about here is our the compensation of our healthcare professionals, health providers,
Yeah.
and the infrastructure. Anyone who goes to Puerto Rico hospital, it's not the same as walking into a mainland hospital. However, we do have U.S. board certified, fully bilingual doctors, which are among the top of the nation. And if there's, George, if there's one thing that I would like our audience to remember out of this recording, out of this program, is the following: the average per capita cost. It doesn't matter if it's George Laws, Medicare, the old Medicare patient, or George Laws, the poor Medicaid patients, or George Laws, the professional in the private health system. If you bundle up the per capita cost, the healthcare cost of private health insurance and Medicare and Medicaid, the public health insurance, and you put a per capita cost per year, George Laws in Washington, D.C. right now, it costs $15,000 a year.
Oh,
That's
wow.
the average per capita cost. That same George Laws hops into the plane and to San Juan, Puerto Rico, and automatically the per capita cost of George Laws, if you bundle up Medicare, Medicaid, and private health insurance, is $5,000 a year. It's a
That's
third of the cost.
crazy.
Same U.S. board certified professionals providing the
Yep.
services. Same compliance of federal statutes and rules and quality measures
And
that we
ultimately the
have to
same
comply
human
with.
needs, right?
The same FDA approved medication and their cost.
Yep.
Medication is fixed the prices are federal prices. So the same price that you pay for Keytruda or for
Yeah, diabetes medication,
any
whatever it is. Yep.
medication is the same in California with the $15,000 a year budget, and in Puerto Rico, we have to pay or make the math work with $5,000 and pay providers and pay office, real estate, and pay utilities for that professional, healthcare professional. So there was an interesting study made by the Puerto Rico Institute of Statistics that said compare the cost of living in Puerto Rico, the cost of living index, the COLI, the cost of living index, and you see that real estate in Puerto Rico, San Juan, Puerto Rico, is the 38th most expensive city in the nation. Utilities in Puerto Rico, it's expensive.
Particularly
Groceries,
electricity. Yeah.
groceries. If, for example, you buy the coffee that I bought, or a milk at the Walmart in Orlando versus the same
Amount. Yep.
milk in Walmart here in San Juan, is more expensive. The only thing that is cheaper, it's healthcare. Why? Because 67% of our population is under a public program, Medicare, Medicaid, and we are operating under these federal formulas that do not contemplate the exclusions that we have of some federal rules and statutes, like the supplemental security income, like the low income subsidy under Medicare, other federal laws that we are, like the Medicaid cap, that we're not in the same formula.
Yep.
All those create a depressed economy and budget. So guess where we have to leverage? on the salaries of our
Yeah.
healthcare
And
professionals.
you know what, Luis? I think this is really important. And let me just kind of take some of the things that you've said and try to map out some of the thoughts that I have around this. One of the impacts of those depressed salaries for doctors, for nurses, for medical administration professionals, and the fact that they are trained to US standards, that they are fully bilingual, and that they're incredibly capable individuals, is that a lot of those folks end up leaving Puerto Rico. So that is a huge challenge because it means that then getting access to care, particularly for specialists on the island, is significantly reduced, not just for the Medicare and the Medicaid patients, but also the private insurance patients, because the doctors and the hospitals and the medical service providers, they rely on the three pillars of funding for their operations. They don't just rely on the private health insurance or on the Medicare or on the Medicaid. Their business model relates to all three and how all three together work. Then the other piece is something you mentioned, which is the quality of facilities and the technology and situation at the hospitals. But let's be even more detailed about that. In Puerto Rico, we've actually had entire hospital systems shut down in recent years. And that's incredibly worrisome because the fact that the economic model for healthcare is not functioning in Puerto Rico is meaning that entire hospitals are having to shut down, or the fiscal situation of the hospitals themselves that are still operating is not in a healthy direction. At some point, the system starts to break down. And the biggest concern that I have, and maybe you can talk about this a little bit from the perspective of the Chamber of Commerce and private sector, is that if Puerto Rico's healthcare system is going through these circumstances, and this consistent uncertainty, it's impacting our budget at the state level, it's impacting hospitals, it's impacting doctors, it's impacting patients. you know, how do you actually help to grow an economy if you've got people essentially having to leave the island to get, equal health care that they would in the States? And the more people leave the island, because the higher wages are stateside and because they're not getting the same care, how do you grow an economy if you're then losing workforce, if you're then losing tax base, if you're then, losing your debt repayment capacity? It doesn't make sense to me. What to me it shows is that the model of territorial inequality is fundamentally unsound, and something needs to change. We can continue doing these little fixes. And you mentioned, you're not necessarily pushing for the full level that we would have as a state. You're just hoping to improve it a little bit. And I think that that's good, right? But at the end of the day, that change is only an incremental change, and it may come with a timeline of just another couple years. Is that really enough to get Puerto Rico to a point where we can actually grow the island sustainably? And in my view, the answer
Yeah,
is no.
yeah, no, the answer is definitely no. If I believe if we're able to get a fix in the Medicare Advantage issue, and we get
That will
tied to the
help.
USVI, that would be it's collectively that's $1 billion more for the healthcare economy, which would be enough to for us
To stave off the whole
to
collapse of the
retain,
medical
because
system.
next time you get a friend from Puerto Rico, a doctor, saying that you're going to the mainland, just say, I know how much more you're getting in your offer. And
Yeah.
it's not that you're a magician or economist. It's just that you just have to say, based on the 5,000 to the 15,000 is three times more.
Yeah.
So whatever offer you got in Puerto Rico, you know that the offer that you're getting in Jersey, New York, and Florida is three times more, because it's a bigger economy.
Yeah.
So that's a give me a bonus I'm giving you there, for to use with your friends. But to fix that, we don't need to be at the 15,000. We're getting 7,000 per capita cost. We can still be the lowest reimbursed jurisdiction in the nation, but we can address our healthcare needs in Puerto Rico, rather than continued having more Puerto Ricans moving to the mainland. I mean, right now we have about The last census was 3.2. I mean, there's estimates that says that it can be now as low as anywhere from 3.2 to 2.8. But we know that there's already close to $7 million, 7 million Puerto
Puerto Rican
Ricans
stateside. Yeah.
stateside in the mainland. So that's sort of our bargaining chip, our negotiation piece, or our strength, carrying the messages that we're carrying in Congress, and that's why we this program, for example, this podcast is so important for our Puerto Ricans and audience in the mainland to help us advocate in Congress uh, for these needs, because Puerto Rico can save funds to the federal government by addressing healthcare issues in Puerto Rico rather than continued having Puerto Ricans, whether it's health professionals working in the healthcare economy of the mainland or patients seeking services. We can save money by addressing healthcare needs in Puerto Rico rather than that, and it would help Puerto Rico's economy, because as you're saying, right now it's unsustainable. Hospitals, yeah, there are some elements that we can work from the local perspective. They need to, policy wise, they need to specialize and not think of, that the island can still operate with the new demographics of the population with 64 hospitals. So naturally there will be
A
more
contraction. Yep.
consolidation and contraction in the market, and they need to specialize, and each and one of them find their niche. It's not that you can have a catch-all hospital nowadays. Only a few of those should be able to do that. But other than that, certainly the element of the funding is something that the Chamber of Commerce, that we've been. That's why the chamber is so active on it, because the private sector is the one that runs the healthcare system of Puerto Rico. Our hospitals are private mostly. Our doctors are private. Community pharmacies, medication, PBMs, laboratories, uh, all the different stakeholders of the system, they're private, except
Yeah.
for our tertiary care Centro Médico medical center is the only government owned, but the rest is all private. The
And beyond the industries in the private sector that are directly related to healthcare, if you're any business in Puerto Rico, whether you're selling retail, clothing, whether you have a restaurant, whether you run an industrial facility, you rely on a healthy workforce and a healthy society. And in order to have a workforce that is doing well, you need to have a healthcare system that provides the basis for that.
indeed. I mean, and something that we didn't touch upon, and I know, I don't know if we have much time, but you mentioned a point about providers servicing all sectors, Medicare, Medicaid, and private. Really, the new ugly duck in the system is the private health insurance market.
Yeah.
Is the system where the professionals like you and me have to seek services in Puerto Rico. Those are the ones that are getting now the longest delays for care. You know why? Because we've been so focused for the past 16 years to improve the level of funding in the public programs, which we have been able to bit by bit increase the base. But unfortunately, now, if I'm a healthcare provider in Puerto Rico, 10 to 1, I want that patient to be a Medicare Advantage patient because of the level of funding that Puerto Rico is getting locally. Second, I want that patient to be Medicaid because we've been able to improve. But the last patient that I want to see from an economic perspective is a private patient. Because why? Because private patients, who pays those services? Well, the employers and the individual.
Yeah.
And unfortunately, Puerto Rico's healthcare economy as a whole, the private economy, has been
Contracting.
decompressing, contracting. So it is
Or
the
at least
most
growing at a
affected.
very, very slow pace.
Correct. So that's really where the challenges now lies. We can dedicate a whole program
Yeah.
if you want to talk about the challenges in private health insurance, because the health insurance plan is trying to keep up an attractive price so Luigi Pizarro and George Laws can purchase an individual health insurance product. But if all of a sudden George Laws or Luis Pizarro need a specialty medication because we have a condition, do you think that with a premium of $150, I can pay a $50,000 medication
No,
monthly?
definitely not. Yeah,
The
that
math
doesn't
doesn't
make any
work.
sense.
So
Yeah.
that's why you see a lot of our folks, Puerto Rican folks that live in the mainland, they keep their Puerto Rico plan because what they pay for in the rest of the nation vis-a-vis what they pay in Puerto Rico is much less here
Yeah.
because it's a reflection of the economy. So here we don't have a Fortune 500 market as robust as you have in the mainland. So we need to re-engineer the whole system to maintain an affordable product, but and then keep the most amount of benefit. So it's very challenging how we make the math work, and obviously it's all at the cost of paying lower to providers, and that's a big challenge that we have in the private
Yeah.
health insurance market.
Definitely. Well, Luigi, it's been a pleasure speaking to you. We greatly appreciate all of your insights and feedback and your commitment to addressing this structural inequality of healthcare funding as it impacts Puerto Rico. Here on the Mano a Mano podcast, we're striving to provide good information about these challenging policy issues, but ultimately, we also want the listener to see that having not just piecemeal approaches, but a wholesale improvement of Puerto Rico's situation by putting us on that trajectory to permanent equal treatment across all federal programs is ultimately the option that is going to provide the best benefit to people on the island as well as to the U.S. government. And in our view, the solution for that is, of course, to resolve Puerto Rico's territorial status and advance statehood. We greatly appreciate your time. Thank you so much, and let's stay in touch.